The oblique sinus of pericardium lies behind the superior vena cava. Which of the following is not a boundary of Koch's triangle? Limbus fossa ovalis is not a boundary of Koch's triangle. The boundaries are tendon of Todaro, coronary sinus, and tricuspid wall ring. Sympathetic innervation of heart is by T2 to T6. Length of trachea is 10 to 12 cm. Which one of these muscles is not cut in posterolateral thoracotomy? Pectoralis major is not cut. Serratus anterior, latissimus dorsi, and intercostals are cut. Esophagus enters through muscular part of diaphragm, part of left lower lobe of lung except enteromedial basal. So left lower lobe of lung part is superior, post basal, and medial basal. Which of the following statement is correct regarding the trachea? The sensory supply of trachea is by the vagus. Blood supply of the lungs are pulmonary artery, pulmonary vein, and bronchial artery. True statement about esophageal hiatus. Vagus nerve passes through it and lie in right crura of diaphragm. Branches of right coronary artery are acute marginal, posterior interventricular, and posterior ventricular. Structures passing through the aortic hiatus of diaphragm are aorta, azygous vein, and thoracic duct. Bronchial artery supplies up to respiratory bronchiole. The commonest variation in the arteries arising from the arch of aorta is left common carotid artery arising from brachiocephalic trunk. The lumbar region of the vertebral column permits all of the following movements except rotation. So lumbar region of vertebral column permits flexion, extension, and lateral flexion. The middle cardiac vein is located at the posterior interventricular sulcus. In angina pectoris, the pain radiating down the left arm is mediated by increased activity in efferent sensory fibers contained in the thoracic splanchnic nerve. Autonomic supply to SA node is sympathetic excitatory. The stability of the vertebral column is due to vertebrae and vertebral disc, interspinous ligaments, and paraspinal muscles. The esophagus is narrowest at its beginning. Left superior intercostal vein drains into left brachiocephalic vein. The arch of aorta lies in the superior mediastinum. The base of the heart is formed by the left atrium. Which of the following is correct regarding SA node? It generates an impulse at the rate of about 70 per minute and initiates the heartbeat. All of the following are true regarding heart except vena cava minimi drains into surface of heart is false. What is true is coronary sinus opens into right atrium. SA node is supplied by right coronary artery and left auricle projects anteriorly to overlap the infundibulum of the right ventricle. Which of the following is correct regarding hilum of right lung? Azygous vein arches over anterior surface. Occlusion of the LAD will lead to infarction of which area? Anterior wall of the left ventricle. The root of the right lung does not lie behind which one of the following? Right vagus. So it lies behind right atrium, superior vena cava, and phrenic nerve. Which of the following do not elevate the ribs? Serratus posterior inferior is does not elevate the ribs. So what elevates the rib is serratus posterior superior, external intercostals, and levator costarum. Superior intercostal artery is a branch of costocervical trunk. Anterior intercostal artery is a branch of internal mammary artery. All of the following structures pass through the superior aperture of thorax except right recurrent laryngeal nerve. So which structures pass through superior aperture of thorax? Left common carotid artery, left sympathetic trunk, and thoracic duct. While doing thoracocentesis, it is advisable to introduce needle along upper border of the rib. All of the following arteries are common site of occlusion by a thrombus except marginal. So common site of occlusion by thrombus is anterior interventricular, posterior interventricular, and circumflex. The following statements are true regarding the SA node except that it is located at the right border of ascending aorta. So what is true regarding SA node? It contains specialized nodal cardiac muscle and it is supplied by the atrial branches of the right coronary artery and it initiates cardiac conduction. The coronary sinus ends in right atrium. Which of the following structures constitute part of ventricle of heart? Trabeculae carini. Consider the following statement: vena cava opening of the diaphragm situated at the level of T9 transmits inferior vena cava, vagus nerve, branches of right phrenic nerve, and thoracic duct. So, which of these statements given above are correct? So, it transmits inferior vena cava and branches of the right phrenic nerve. The normal narrowing in the middle of the esophagus is caused by left main stem bronchus. The last tributary of the azygous vein is right bronchial vein. Structures that pass from thorax to abdomen behind the diaphragm are all except greater splanchnic nerve. So, which structures pass from thorax to abdomen behind the diaphragm? Azygous vein, aorta, and thoracic duct. Most common site of Morgagni hernia is right anterior. Difference between typical cervical and thoracic vertebrae is that it has a foramen transversarium. All of the following characteristics differentiate a typical cervical vertebrae from a thoracic vertebrae except that it has a large vertebral body. So, which are the characteristics that differentiates a typical cervical vertebrae from a thoracic vertebrae? It has a triangular vertebral canal, it has foramen transversarium, and superior articular facet is directed backward and upward. A potential anastomosis is seen in coronary artery. Which of the following duct commences in the abdomen as an elongated lymph sac of the cisterna chyli is thoracic duct. In a case of chest pain with pericarditis and pericardial effusion, pain is referred by phrenic nerve. Pleural tapping in the mid-axillary line, muscle not pierced is transversus thoracis. So, which muscles are pierced? Internal intercostal, external intercostal, and innermost intercostal. Which of the following is the most cranial structure in the root of left lung? Pulmonary artery. If circumflex artery gives the posterior interventricular branch, this circulation is described as left dominance. Direct opening in the right atrium with anterior cardiac vein. In the lungs, bronchial arteries supply the bronchopulmonary tree till respiratory bronchioles. The thoracic duct receives tributaries from all of the following except right bronchomediastinal lymphatic trunk. Tracheal bifurcation is at which level of vertebrae? T4. Fibrous pericardium is attached to central tendon. Anterior interventricular artery is a branch of left coronary artery. Which of the following is true about the starting course of azygous vein? Posterior to inferior vena cava. True about anatomy of right ventricle, it is more prominent trabeculation and crista supraventricularis separate tricuspid wall and pulmonary wall. Apex is trabeculated and TV and PV share fibrous continuity. True about latissimus dorsi, nerve supply from long thoracic nerve, inserted into bicipital groove of humerus and used to fill up back defects. Boundary of triangle of auscultation is not formed by serratus anterior, it is formed by scapula, trapezius and latissimus dorsi. In a subclavian artery block at the outer border of first rib, all of the following arteries help in maintaining the circulation to upper limb except superior thoracic. So, which arteries help to maintain the circulation? Subscapular artery, thyrocervical trunk, and suprascapular artery. Aortic hiatus contains left gastric. Uh, Aortic hiatus contains azygous vein and thoracic duct. Blood supply of pectoralis major muscle is thoracoacromial trunk and internal mammary artery perforating branches. As viewed from the right atrium, the floor of the fossa ovalis is formed by septum secundum. The thoracic duct crosses the posterior mediastinum at the level of which vertebrae? T5. Spinal epidural space contains areolar tissue and internal vertebral venous plexuses. Spinal epidural space is the largest at the level of the third lumbar vertebrae. All of the following are true about phrenic nerve except that it is purely motor nerve. What is true is it arises briefly from C4 spinal nerve. It is formed at the lateral border of scalenius anterior. Accessory phrenic is commonly a branch from the nerve to subclavius. Which of the following statement is true about diaphragm? Left side is lower than right side. Right side pushed up by lever and hernia common on left side because of weak origin. True about left phrenic nerve lies anterior to anterior scalenius muscle. Left side superior vena cava drains into coronary sinus. Occlusion of the left anterior descending artery will lead to infarction of which area? Anterior wall of left ventricle. Which of the following is not a tributary of azygous vein? Left superior intercostal is not a tributary. So which are the tributaries? Right posterior intercostal, right superior, and accessory hemiazygous. True statement about right coronary artery: diameter is less than left coronary artery. Right coronary artery arises from anterior aortic sinus. Right coronary artery supplies major part of right atrium and right ventricle. Constrictions in esophagus are present at distance of 25 cm and 40 cm from incisor. The surface marking of the arch of aorta is as follows behind the manubrium sterni. Veins are an example of capacitance vessel. Hazel's corpuscles are seen in thymus. Which of the following accompanies the anterior interventricular artery? Great cardiac vein. At what level does the trachea bifurcate? Lower border of T4. Which of the following represent the surface marking of the aortic wall? Sternal end of left third costal cartilage. Which of the following is supplied by the abdominal aorta? Sequestrated lung tissue. Inferior vena cava pierces the diaphragm at which vertebral level? T8. Arch of aorta lies at what vertebral level? T4. All of the following lie between the first rib and the apex of the lung except thoracic duct. So what structures lie between first rib and the apex of lung? Superior intercostal artery, first posterior intercostal vein, and sympathetic trunk. What is true about sinus venosus? It forms smooth wall of right atrium. Subscapular sinuses are seen in lymph node. Which of the following is not supplied by the right coronary artery? Right bundle branch is not supplied by RCA. So what is supplied by RCA? SA node, AV node, and AV bundle. Surface marking of the mitral valve is left third intercostal space in the mid-clavicular line. Superior vena cava opens into right atrium at the level of T5. Opening of esophagus into diaphragm is at the level of T10. Isometric relaxation is defined as relaxation of left ventricle with mitral and aortic wall closed. Distance of the lower esophagus sphincter from the upper incisor is 37.5 cm. Transverse sinus is present posterior to which structure? Aorta. Aortic area for auscultation overlying the chest wall is located at second intercostal space on right side. Lymphatic drainage of cervix is to all except obturator. So lymphatic drainage of cervix is to internal iliac, external iliac, and sacral. Hyaline cartilage of respiratory tree extends up to bronchi. Length of adult trachea is 10 to 11 cm. Sympathetic supply to heart is up to T4. Esophagus shorts at which level? Lower border of cricoid cartilage.